Hello, I'm Dr. Brandt Gibson, and we've been talking to you about hammer toes, which is basically curling of the toes at the joint that cause it to curl like that. Um, that's a pretty big deal, can cause pretty significant discomfort, significant pain, and so forth. And so, one of the things that I want to do today is talk to you about different things you can do for this at home. And there are multiple different options as far as how to treat hammer toes at home. And I just want to talk about a couple of them. One is appropriate shoe gear is key in managing hammer toes. For example, if you wear shoes that have actually more space around the toes, a deeper toe box or a wider toe box actually takes the pressure off those joints, and the hammer toes become less of a problem because they're not rubbing on the top of the shoes, or they're not getting extra pressure in any of the areas. Or the also, you want to make sure that the length of the shoe is enough that it's not causing longer toes to need to curl to fit in the shoe. The second part of appropriate shoes is heels. I'm not going to tell you can't wear heels, but it's recommended that high heels are limited. You don't want to have the really high 3, 4, 5 inch heels. 2 inch heels or lower are probably the best. And then the third piece of that is wearing the appropriate shoes for the activities that you're doing. Running shoe for running, and so forth. So any of those kind of things will actually reduce the progression, reduce the problems that come with hammer toes. Number two, you could actually pad the area. There are multiple different types of pads you can buy for hammer toe deformities. Some of them are medicated, some of them are not. I recommend the non-medicated because they're not going to cause damage to any of the tissues, but they can actually cause padding. There's different ways. There's sleeves that you can stick on that are just gel sleeves that make it so that the hammer toe doesn't rub. There are little splints you can slide on that hold the toe down so it doesn't allow it to curl up when you're standing or walking. And then there are just little, almost like Band-Aid type things that, again, are just pads to prevent it. We don't want the ones, again, that have medication on it or acids on it because they can cause other damage or other problems. Number three, you can actually massage the area. You can actually do things to massage the tissues and so forth just to reduce symptoms. Number four, you can use ice or anti-inflammatories for any inflammation or pain. Number five would be basically taping or splinting. We talked a little bit about splints that hold the toes down, but you can actually also tape the toes down, the same type of thing, just to keep them from being a problem. So the idea, what you basically want to do is you want to reduce the pressure, reduce the progression, and reduce the problems that happen from the hammer toes, because in the long run, if you don't have significant pain, if they don't have significant limitation, then we don't need to do any aggressive type treatments. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 254, hammer toe deformity and how you can treat it at home. Thank you, and have a great rest of your day.